Menopausal changes, vaginismus, decreased sex drive, erectile dysfunction, decreased libido, and more. Yes, today we're talking about the S word, and I don't mean senility. S is for sexual dysfunction more specifically. Through our lives, sexuality is an important component of emotional and physical intimacy. Many people in their 70s and 80s are not only sexually active, but generally satisfied with their sex lives and express their interest for maintaining sexual activity. But, yes, there's a catch. Getting older also means increasing the likelihood of encountering problems that put a dampener on sex and intimacy. In fact, about a third of the elderly population has at least one complaint with their sexual functioning. With many of us older men and women also approaching the second half of life as newly single, the presence of sexual dysfunction can be somewhat troublesome and when wanting to embark on new relationships. But it also goes deeper than that. There are psychological issues around intimacy and sexual dysfunction. The good news is there are solutions to many age-related sexual dysfunction issues for men and women. Joining us today to help us understand all things age-related in the area of sexual dysfunction and what we can do about it is Dr. Jane Offor. Dr. Jane is an experienced and skilled GP and specialist sexual medicine practitioner. Having originally trained at Monash University, she comes with an extensive medical experience, including many years as a co-owner of the Mount Martha Village Clinic. Hello and welcome to Ironing Out the Wrinkles. I'm your host, Ros McMaster.
Hello, I'm Kate, your other host, and together we are taking the age out of ageism, helping men and women over 50 embrace aging with less fear. Jane, welcome. We are so excited that you have come here today and to share your knowledge on such an interesting topic. May I just, before we look into any of the age-related sexual issues faced by men and women, we'd like to know what led you down the path from GP to specialising in sexual medicine.
Yeah, look, it's lovely to be here, ladies. It's a great topic and I love talking about it. So anybody who's prepared to listen to my passion for talking about sex. General practice is a challenging career. And I think I was always interested in the interaction between mind, body, culture, and how that all played out in our health. Now, in my medical training, we were very, early on taught to try and think of our health as a biopsychosocial model, which means we're supposed to look at how biology and psychology and culture and everything will interact. But I have to say, that pretty quickly gets pushed into the background and you go into a very medicalized world where actually medicine seeks to separate mind and body, and which is a really kind of artificial construct. And so it focuses on, treating the diseases of the mind or diseases of the body. And, as I progressed through my career as a GP, it became so obvious that so much of the distress or illness I was dealing with was actually a consequence of what was happening in people's lives or what had happened to them in their lives, their individual psychology, their diet, their lifestyle, their family, their stress, all of those things. All of that was all influencing their health. Now, as a GP, 10, 15 minutes, patient in, patient out, patient in, patient out. The business model, the way it's remunerated, it rewards speed, throughput, efficiency. And, it doesn't reward helping patients achieve long-term changes to their lives, and improvement in their lives. And so, you treat the symptoms, you find the serious diseases, but to actually spend the time with patients to really properly understand the depths of all of the issues and where they were coming from was really difficult to achieve in a general practice context. So, to be honest, after years and years of doing that, I became really quite disheartened because it kind of almost leaves you feeling a bit spiritually bereft, that you're just not really doing the job as well as you can.
So your clinic was in Mount Martha, wasn't it, in Victoria?
Yes,
And
that's
then you
right.
moved to Mornington. Yes.
Yeah. And look, really, I actually decided I didn't want to be a GP anymore. But look, take note, I did not succeed in that. I am still a GP, but I have this wonderful side gig, which is what probably keeps my passion kind of going. And so, really, why did I do this? Because I needed to create a job for myself so that I didn't end up with a grumpy, bored, sort of 60-something-year-old GP. And so, look, I thought sexuality interested me because it brings together everything. It brings together how the physical body, our individual psychology, society, culture, gender, our relationships, all of it dances together and in how our sexuality is expressed. And to me, it was the perfect kind of opportunity for me to get away from what I still do as a GP, and I try and do it really well, but it's fast lane. It's life in the fast lane, and it's really, really challenging. I get to spend a wonderful hour with patients and dive in deep to really understand how all of those things play together, and that's really what interested me in it. So when I thought, look, you know what, I reckon this might suit me, I already had the medical knowledge because there's a medical component to what I do. And so I started to kind of really binge listen to podcasts and audio books and read books and talk to people. And I got really hooked. I mean, I could listen to 3 hours of Dan Savage, he's this American sex and relationship podcaster who's pretty out there. But I can tell you, I learned a lot in my 3 hour binge listening episodes to his stuff. And it really made me go, you know what, I can do this. I think this is a good fit for me. And also it's an incredibly private part of people's lives. Our culture's still pretty closed when it comes to sex. We can joke about it, but to actually speak in an authentic and vulnerable way to each other about it, or even to your doctor about it, still really hard for most people. And I knew that I had the professional experience to do that comfortably. I was really comfortable talking to patients about sexuality. And I felt that that's, in my job, it was an opportunity for really profound kind of human connection around something that people really have trouble talking about and can't access the right, there's not many services around. There's particularly out in outer metro area, there's not really people, it's not easy to go and find someone to talk to about a topic like this. So, it's that's part of the story. The other part of the story is I'm in the latter part of my career, and I've got this massive life experience, not just my professional experience, but my professional experience of talking to people, hearing people's stories. You learn so much from your patients. And I've got a 63-year-old body that I've lived in. It's been through all of those landmarks things that we do as women. I've gone through puberty, needing contraception, good sex, bad sex, teaching about
Yeah.
sex. I've been pregnant, I've given birth, I've breastfed, I've raised kids, I've gone through menopause, I've been in a long-term relationship, I've been divorced, I've been single in my 50s, I've had sexual droughts, I've repartnered. It's still ongoing. I've had a hip replacement, and having a sore hip, that affects your sex life. So
you're real.
And it was like a good fit for me, bringing together all of those elements, the medical part, which I still do like, and then the kind of, it felt like a wise thing to do in my latter part of my career. And I absolutely love it. It's really fascinating, challenging and heartwarming sort of work to do with people. And I can spend an intense hour with someone and it's intense, but I can have a really good feeling often at the end of it, that you feel like you've really done something that was worthwhile for that person. So that's kind of how I got here.
Oh, that's fabulous. And because I know I've been to specialists to talk about issues as well. You literally given 20 minutes
Yeah.
and it was all very clinical. He didn't really spend any time with me and he was making notes, to give to his receptionist for my records.
How rude.
When he was speaking into his little dictaphone,
Yeah.
he was giving details. He was getting my information wrong. And I had to keep
Oh.
interrupting him and saying,
Oh,
no, that's not what I said. That's not what I said. And then you're sort of out the door. So to think that someone might spend time with you, and for women in particular, I don't know if you see more men than women, more women than men in your service, but yeah, like women like to see women doctors, don't they?
Yeah, yeah. Look, I do see more women than men, and I think the reason for that, there's a number of reasons. Women are better help seekers, so they're more likely to seek help, but also, and they're probably more used to being vulnerable in talking about themselves than men are. But also, in terms of difficulties around sex, there's a very gendered culture around sex, so more women probably do experience difficulties of different sorts, a lot of it because of the gendered overlay of how sex plays out in our culture. So yeah, but I do see men, and I have some wonderful consults with men, and I've had very young men, and I've had older men repartnering with erectile dysfunction, exactly the sort of things we'll talk about today. And some of them are just, some of those consults with those old with the older people who are from a slightly more conservative generation, are some of the best because yeah, because it's such a unique experience for them to actually make themselves that vulnerable to talk about it.
Yeah.
Very
So,
brave.
so what are the more common age-related dysfunctions that people come to see you about?
Yeah.
What's your,
So
you've got a top list or something, don't you? What do you
I
call it?
have, yeah, like I think I was calling you my top ticket items.
The top
So,
ticket items. Okay.
I like that.
yeah. So, look, first of all, I might just quickly run through for both male bodies and female bodies the different actual physiological changes in our kind of sexual functioning that do happen with age. So for women, of course, there's the massive hormonal changes that occur at menopause, and I think the menopause transition is a very important kind of time of women's lives. And the other part of my practice is actually that I do a lot of menopause medicine, which is really satisfying stuff to do. So they do, of course, have that very sudden change in hormones at menopause, and there are sexual consequences of that, which I'll talk about. And then the other hormonal change with age is just a slow drop in testosterone. So testosterone is a hormone most of us think about as being the male hormone, but in fact, women do have testosterone, and we have much lower levels than men. But our testosterone level sort of peaks in young adult life and then just slowly declines. There's no kind of massive drop off at menopause, but it's one of the little factors that can play into age-related changes. So, what happens to a woman's body? Particularly, it's related to the sudden reduction in estrogen. So, a woman's, sort of vulva, vagina, urethra, all of that area is, bathed in a really nice amount of estrogen for all of her life prior to menopause. Then she hits perimenopause, which is probably the time that's best characterized as hormonal chaos. And during the time of hormonal chaos, that can be very problematic for women. And then settles into postmenopause with low levels of her reproductive hormones. Now, so what happens then is very substantial changes in the vagina, vulva, urethra, and so the whole area becomes more delicate, and drier. Now, if you think about it, estrogen helps keep that area able to cope with the physical kind of aspects of sexual function, and childbirth and all those sorts of things. So it's actually amazingly tough, really, usually. But after menopause, with the lack of estrogen, the tissues become much more delicate. So, they're much more susceptible to irritation, to trauma. So, things which our bodies coped well with before, like, say, like intercourse or whatever, can become, really quite painful. The vagina loses its elasticity. So the vagina, if you're going to be having intercourse, the vagina has to be able to stretch both sideways and lengthways with thrusting. Now, all of that changes gradually with time after menopause, and you can have not just dryness, but you can have real pain with intercourse. And also, you have sort of less blood flow during arousal. So that means that there's a reduction in blood flow to the area. So there's the physical changes of arousal are kind of slower to happen. So normally with arousal, there's increased blood flow to the clitoris, which enhances kind of clitoral sensitivity, and the walls of the vagina. Blood flow comes to the walls of the vagina, so they're nice and cushiony and then nice and moist. So all of that is reduced. Women require more stimulation to become aroused. So, maybe more direct clitoral stimulation, just a slower build of kind of arousal. So for some women, that can be a surprise, because the type of sexual encounters they've enjoyed before just aren't quite doing it for them. Their body has changed, not responding to quite as much to the same stimulation as what they've had previously. And there may be more stimulation required to actually reach orgasm. Women generally still have the same ability to achieve orgasm after menopause. It's just that the amount of kind of stimulation required to get there might be a bit more. Then there's, of course, things like an increase in the risk of prolapse, so urogenital prolapse, so vaginal prolapses and things like that, again, because of the loss of estrogen. And, having a prolapse or developing, for instance, urinary incontinence, which is more common after menopause. Having a prolapse and urinary incontinence, leads to things like a fear of loss of control of your bladder during sexual activity. So where you might have felt quite comfortable with that area, then you start to feel a little bit of the ick factor because you're worried you're going to wet yourself.
Yeah, we've been there.
Yeah, and I mean that's
so
apparently the research on women. One of the biggest impacts on women's sexual function is if they have urinary incontinence. Has a huge negative impact on women's sexual function. There's some head nodding going on here.
Yeah, it's humiliating.
Yeah, lots of head nodding for anyone who can't see the video. Kate and I, that's right.
Then there's the sort of libido changes, which are a little bit more complicated, and I might just leave that because I'm going to talk a bit about libido later, about how it works, because libido is always complicated. And then of course there's increase in cancers as women get older, so breast cancer, other gynecological cancers. So breast cancer, for instance, you've got a 1 in 7 lifetime risk of having breast cancer. That's huge. Yeah, exactly. And so because of the breast cancer treatments, so even if a woman's already gone through menopause, pretty low hormone levels, you just knock off that last bit by putting her on estrogen blockers, and that's really, really tough. But these things can be helped, but there's still a lot of fear and ignorance out there around managing all of this kind of stuff. There's body image challenges to do with body changes post-cancer and things like that. Of course, if a woman's had to have genital surgery for some reason, all of that too. So there's a lot of stuff that can go on there. So with women's bodies and aging, the big ticket item that I deal with, and I deal with this all the time, particularly with my menopausal patients, it's that women who are heterosexual starting to have pain with intercourse. So it might start off as a little bit of dryness. They use a little bit of lube, but then it starts to actually perhaps get some little splits and some actual pain. Now, often, unfortunately, that is not the point at which women go and seek help. Or they might go and seek help and not have an adequate explanation about what their options are and how to use the appropriate treatments. But sadly, I see an awful lot of women who seek help very late for the simple problem of vaginal discomfort with intercourse or with other things after menopause. Whereas if they came early, saw somebody who actually knew what they were doing, really a lot of that stuff could be effectively managed. And particularly there's a lot of women who could have benefited from using vaginal estrogen treatment, but either because they have heard some negative kind of things about it, or they made the mistake of reading the leaflet inside the box. So what's called product information, which comes inside boxes of medications. You may have experienced these things, and they're very big and very thin paper.
Yeah.
Terrifying. They've got a million words on them, and they're probably written by lawyers. They're really unhelpful, really, really unhelpful. So women go in there and they read that vaginal estrogen, which is a tiny, tiny dose of estrogen, which very, very little of which is absorbed into your bloodstream. It predominantly only helps the genital area. It says in there it might cause cancer. Now, even women who have breast cancer and have been reassured by their oncologists that it's okay to use vaginal estrogen, which now it is considered to be mainstream acceptable to use vaginal estrogen when you've had breast cancer. But even then, they'll read this blimming product information and go, oh, no, I'm not going to do that. No. Yeah. So my big ticket item is that please go and talk to somebody who knows about managing the urogenital problems after menopause, because there's a lot that can be done. Even simple stuff like, apart from vaginal estrogen, there's different types of lubes. Now, most people don't know much about lubricants, and I probably didn't know much about lubricants till I went through menopause either. But some lubricants work better than others. Some suit some women better than others, And so I get out my little sample things and put it on their finger and get them to, rub it around, and they'll go, oh, wow, yeah, like that. That works really, really well. So I've got a kind of, a few sort of particular products that seem to be quite good for older women. And to have an open and frank conversation with someone about something like lubricant can be very useful.
Yeah, I didn't know they differed.
Yeah, there's water-based lubricants, and there's you can use natural oils and things, and then there's silicon-based lubricants. And the silicon-based lubricants actually last a lot longer. They're a lot slipperier for a lot longer. And I've just found that quite a lot of the women I deal with who've had limited, water-based lubricants are fine, but they have to kind of stop and go, oh, quick, put some more on. And, it's, that's okay, but it's not always that effective. That the silicon-based lubricants will actually give them a lot more relief from comfort and a lot more pleasure.
Yeah. But you have to do a lot of research about the silicon-based ones too, don't you? Because some of the ingredients can be rather disagreeable.
Yeah, well, look, I pretty much have one product that I tend to recommend, and so I tend to give I've got a resource list from my menopause patients, and suggest that they try that particular one. And as far as my limited research is done, I'm pretty happy with that. So, and even with the water-based ones, of course, they do differ. So I've kind of stuck with a couple of places I tend to refer women to look at the water-based ones as well. Yeah, so for women, that's really there is help there to help you with these issues. But beyond that, I mean, estrogen is not a panacea. It doesn't solve everybody's problems. You do need good lube. You need good communication. I am absolutely bowled over still by the number of women who will not tell their partners that it's actually painful. They are scared, embarrassed, don't want to hurt his feelings. I don't know, a million different reasons, but they do not let them know that it's actually not only is it not feeling good, it's actually hurting. And therefore, when you then know that your next sexual encounter is likely to be, not like it used to be, it's kind of like, oh, yeah, don't really feel like it. But yeah, I love my husband or my partner, or I'd like to see maybe it'll be better this time. So you do it again and it's like, no, it's still not good. And so actually continuing to engage in a behavior that's meant to be purely for pleasure, really is for pleasure, and yet it's actually causing discomfort, that then becomes duty sex, which, there's nothing completely 100% wrong with that occasionally, that's okay. But if that's the only reason you're engaging in sex is for someone else's pleasure and it's actually causing you pain, I really struggle with that. I use the analogy, I say to women who do not inform their partners that penetration is causing sex. I say, imagine if he came up to you and said, oh, hey, darling, how about we have sex tonight? And then he stomped really, really hard on your foot and said, gee, I love you, You'd go, oh, that's really, really weird. He's caused me pain. Well, he loves me. What are you talking about? And yet they will tolerate pain during sexual intercourse. But they wouldn't tolerate their partner causing them pain unless they're into things like that. But it's really a really odd, and it's all to do with the kind of gender overlay in our culture that women will tolerate sexual pain. I've had young women who have tolerated sexual pain for years and never even spoken to their partners, who they otherwise appear to have a loving relationship with. They have not spoken about the fact that every time they have intercourse, it's painful. So
the partner would probably really want to know that too, wouldn't they?
Absolutely.
Well, they certainly wouldn't want to know that they're hurting you, but I think it can be a real issue for people who are, going on the dating scene again as well, because you want to have an intimate relationship with someone, but I imagine it might stop you even having, going out in search of a partnership, because how do I tell someone I've just met on the dating service that I don't want to have sex? Because it's too painful. It's like, you're avoiding having a new relationship for that reason.
That's exactly right. And sometimes, for various reasons, women in an older age group may have many years without having a sexual partner, but then something happens and they meet someone and that's a lovely thing. But then it's kind of like all of a sudden they're going, oh my goodness, I've got this thing to deal with. They might not have even known really, because unless they were actually engaging in anything like that, then they didn't realize. So so that really is a really great time to get to get help. Some women, of course, will stay on hormone therapy, systemic hormone therapy, what we call, used to be HRT, now it's called MHT, menopausal hormone therapy, and that certainly helps with the urogenital issues as well. And women will stay on that for a variable period of time after menopause. That's a very individual thing that they have to sort out with their doctor as to how long they stay on it. But but for a lot of women, they've got through the menopause transition. They're otherwise doing okay. They're accepting and adjusting to their postmenopausal body, but the urogenital issues can really cause difficulties.
Wow,
very much so.
Yeah,
so that's
very complex.
It's in your head. That's right.
So that's my big thing for women. Let's talk about men. People are always interested in, low testosterone in men. What actually happens to men's testosterone as they age? Now, men don't go through a male menopause because menopause is a sudden transition. But what men do go through is a slow decline in their testosterone level from a peak of at about the age of 30. But the rate at which their testosterone declines is very variable. And it's not testosterone deficiency, although it does occur in some men that they develop a range of symptoms, not just sexual issues, but a range of symptoms that may be related to testosterone deficiency. That's not that's not the majority of men. However, for all men with aging, there will be some changes. So how does a man's body change? They're slower to get an erection. So, and I'm sure, most men will go, compared with when I was 25 and all I had to do was look at a woman and, there it was. As they get a little bit older, they may even have to start, actually having some physical engagement before their erection might come. And they also require more stimulation. So that might mean all sorts of stimulation, more visual stimulation, more kissing, more cuddling, more touching, whatever, more intercourse, whatever. So they need more stimulation to get a good erection and to maintain their erection. So, let's say during lovemaking, they've got a nice erection, but then they're focusing on their partner's pleasure for a while, and their erection might wane a bit. And this often really freaks guys out and it makes them quite anxious. But actually, it's all right. It's normal. All it means is you then, when you focus you've stopped focusing your attention predominantly on your partner and you bring your focus back onto you, the erection will come back. Whereas if you start to freak out about it and get really anxious, that will then make it much harder to get your erection back. So erections wax and wane depending on the degree of stimulation, and that becomes more apparent as men get older.
And as I'll say myself, as someone with low libido myself, the thought of having to do all that work just sounds exhausting. It's enough to stop me wanting to get into a relationship. I'm like, it's got time for a man.
Just some nice underwear.
I just can't be bothered.
Look, it's not. I don't know what your degree of recent sexual experience is, but I'd have to say, being, having had a few different partners over the years that I was single, it's very variable, and it's not really. That makes it sound like it's awfully hard work, but I don't think it always is.
If you're attracted to someone and interested in them, you want to make that effort, don't you?
And if they're really attracted to you, then so so don't let it put you off. The erections often, they become less rigid with age. So I've had some kind of interesting experiences with older women whose husbands have gone and got erectile dysfunction drugs. So, what we call sildenafil, which was the little blue pill that we all know the brand name of that, but it's now available much less in much cheaper versions than the well-known brand name. So they've been used to a gradual change in their husband's or partner's erection, and then all of a sudden they feel like, one woman said to me, it feels like I've got a broom handle up my vagina.
No. How uncomfortable.
Well, for her, she was in her 70s, and they'd still always remain sexually active, but her 70-year-old vagina didn't like his penis being back to what it was when he was much younger. Whereas a softer, erection that was still enough for penetration was fine for her, and yet he felt great about it. So that's kind of an interesting, yeah. Men's orgasms tend to become less intense, and they also have a longer, there's this, all these funny medical terms called the refractory period. The refractory period is how long can they go after ejaculation or orgasm before they can do it again. So, young guys, the several times a night type deal. And then as they get older, so with an 80-year-old, it might be 3 days before he can get an erection again. It's just that refractory period gets longer and longer, but they still might, once they've had time to rebuild all the little chemicals in there that are needed for it to all happen, they then might be right in a week's time or something. So let's talk a little bit about men with erectile dysfunction, because that really is a significant problem for some men as they get older. So here's my big ticket item about men and sex as they age. Sex doesn't equal intercourse. So guys, if you're listening there and you might be older, you might be my age, 63, you might be 73, you might be only 50 something. You did probably grow up in an era where when we talked about sex, if you're heterosexual, if someone said to you, hey, when did you first have sex? You were thinking, oh, intercourse. Yeah, when did I first have intercourse? That first fumbling, awkward, not very enjoyable experience. Sex is not intercourse. So what is sex? Sex is everything that we do as humans, either on our own or with other people, that actually awakens our erotic part of our self and gives us sexual pleasure. So sex is all of that. However, in our culture, we have a very penis in vagina, intercourse focused view of sex. Now, the consequences of that are many and varied, and I could go on about it for a long time. But I think, sadly, what happens is for many men, when they do, or if they do experience erectile dysfunction, it can be pretty devastating. And I completely get that, because their whole view of themselves as a man sexually has been invested in the performance of their penis. So what happens is penis failure, sex stops. Now, I've had women sit in my room as a GP, just comes out of somewhere in the consult. I ask a question, something happens, and I have women in tears telling me that since their husband had erectile difficulties, possibly commonly these days it'll be because of surgery or treatment of some sort for prostate cancer, or it could be just age-related erectile dysfunction or diabetes or circulatory difficulties or something. And she says, and now he doesn't even touch me. One woman said to me just this week, he's replaced our physical, sexual, intimate life with going to golf. She said, I have been displaced by the golf course. All I get in now is a cursory peck on the cheek as he goes out the door. I don't get a hug. I don't get anything. And so these women are hugely grieving that loss of connection, that loss of physical, intimacy with their partner. And, as far as they're concerned, okay, they really feel for their partners and how they've been affected by their loss of erectile function, but they still would love to be sexual with them. They'd love to be physical with them. And they're really, really upset about that withdrawal of that kind of intimacy. Now, I don't hear about all the great couples who figure this stuff out for themselves. I remember chatting to a medical colleague at a conference of all things. And I don't know, like usual, I was probably talking about sex. And she said, oh, yeah, I've got a great lover. Not a boyfriend, not a partner, great lover, friend with benefits, and we get together and he's got erectile dysfunction. He's the best lover ever, So she had this wonderful man and they had a lovely time together. It was very pleasurable for both of them. And yet he wasn't able to achieve an erection. I've got no idea why, but it was not a problem for both of them. They both had really fulfilling, enjoyable sex. So there you go. That's what sex is.
Because it's communication, isn't it?
Oh, hugely. Yeah. It hugely is. Now, erectile dysfunction, it is an important issue to be addressed. And it's really interesting. The research on erectile dysfunction found that if you look at men who go on to develop cardiovascular disease, so blocked arteries in their heart, most of those men, many of those men, up to 2 years before they knew that they had heart difficulties, had developed erectile dysfunction. Erectile dysfunction is a little bit of a canary in the coal mine for cardiovascular disease. So we know that men who have high cardiovascular risk, so overweight, smokers, high blood pressure, high cholesterol, all of those sort of well-known cardiovascular risk factors, that correlates quite strongly with the risk of erectile dysfunction as well. Diabetes, sorry, was of course a very important one on there too. So, for the guys listening out there, if you are having any erectile difficulties, look, go and have a good chat to your GP. Your GP may not know that. I learned about that when I did my specific sexual medicine training about the 2 years before other cardiac issues surface. And so there's a lot that your GP can do to actually more thoroughly assess whether you're already developing blocked arteries in your heart and things, because the penile artery, a lot smaller than the coronary artery, and shows up the blockages, the narrowings earlier. So what can we do about erectile dysfunction? Well, all men with erectile dysfunction should have their testosterone level checked, because I think something around about a third of men with erectile dysfunction do have significantly reduced testosterone and may benefit from having supplementation with testosterone. Many men don't, but it is a factor that must be checked out. Those men with erectile dysfunction should also all have their cardiovascular status assessed, blood pressure and all those sorts of things. But then what can be done to treat it? And of course, the advent of the first medication for erectile dysfunction came out as under brand name Viagra, which is sildenafil. Was a really great step forward for men with erectile dysfunction. It's an effective drug and has been, really helpful for a lot of men and a lot of couples to continue having an enjoyable sex life, including intercourse, if that's what they want to do. And now, fortunately, the cost of those medications has come down a lot because they're available in generic formulations, so you don't have to pay for more expensive brand name things. They can be used either just for an episode of sex, where you decide, you may want to talk to your partner about it, say, hey, let's plan for, Saturday afternoon or whatever, and that he knows to take the medication a couple of hours before and all of that sort of thing. Or there are some men who take there's one called tadalafil, which can be taken as a daily drug. That was really quite expensive. It's come down in cost now, which is great because there's generic brands available. And so some men prefer to take it every day so that they can have a more spontaneous or more frequent kind of sexual engagement. So either or, and that's the sort of conversations I have with men. I remember a recent patient of mine, delightful man who had he was lucky. He repartnered with the most amazingly sexually liberated woman, and I think he was just thinking, oh my gosh, how lucky am I? But he does have erectile dysfunction, and we were able to sort out how to make the drugs work for him, and by using daily medication instead of just for episodic medication. And he has the most marvelous sex life, with his new partner. So and that's such a lovely thing to see. His confidence, the confidence to engage in that new relationship. He'd been through, his wife had died. He had to keep bringing up children on his own. It was like, yeah, this is my time. This is my time to have more pleasure. And then his penis was letting him down. And so, so in the end, the outcome was very good for him. He's really happy. He's, been able to engage with somebody they've really maximized their sexual connection, which is such a great outcome. So that's really the big thing for men. I mean, of course, there's also sex toys for men. A lot of people don't realize that there are sex toys for men. So there's even vibrators for men, because even men, if men who have erectile dysfunction can still have an orgasm, so they can still get that pleasure of that build up and that climax. And there's a kind of special little kind of vibrator that can help them achieve that if that's important to them. And so, there's all sorts of things that can, improve their enjoyment. Early on, when men have got sort of some degree of erectile dysfunction, but still they can still get by. They can use like cock rings, so sort of something that provides a little bit of constriction to the base of the penis and just helps keep the erection there for a bit longer during intercourse. So that's a really simple one. So that's the kind of two big ticket items for men and women. But I've got a list of other things that I'd like to talk about.
Tell us, please.
Far away.
We're all ears.
Actually, look, I've got a whole page that I came up with of other things that can go wrong with aging, which, everybody out there will have at least one on these list. I mean, of course, with aging, a whole stack of other stuff comes along. Cardiovascular disease. You might be not cardiovascularly very fit. You might get short of breath. You might become very overweight, which has implications for your fitness, your ability to move and engage sexually, your self-esteem, all those sorts of things. Diabetes becomes increasingly common with age, and along with diabetes comes erectile dysfunction, either because of the cardiovascular issues or because of nerve problems with long-term diabetes. But probably the most common is going to be musculoskeletal issues. Now, who hasn't got a sore joint? Are you going to tell me you haven't got a sore joint?
Yes, definitely got a sore joint.
Right, okay. So, don't you think about how wonderful and flexible and everything your body was when you were young, but you were silly and self-conscious and didn't appreciate your wonderful body? For me, I got older. I feel so much more comfortable in myself, but my hips hurt and my knees hurt and my shoulders hurt. I had a hip replacement. It was wonderful. Sex before the hip replacement versus sex after, really different, because you just don't have that flexibility. So, hip and knee issues really, really common. The hip issues often affect women more, but the knee issues are more common in men. So bad knee arthritis. So, so couples who may have had a little bit of a limited palette, a limited repertoire of sexual practices, positions, all those sorts of things, have to start to just get a bit more flexible, not flexible, you're less flexible, aren't you? Get more creative.
More creative,
yes.
Think more flexibly about all the different ways you can get your bodies in contact with each other. And, if you saw me sometimes in my consults, as I'm trying to sort of demonstrate to people how they might, they might position their bodies, which might work for them.
Aren't you great?
I think I need a sort of like a Kama Sutra poster, but then it might set the bar a bit high, because I think some of those positions are really a bit extraordinary. I don't really quite know that can be achieved. And then there's all the cancer. We talked a little bit about breast cancer, prostate cancer, other gynae cancers can affect you, but any sort of chronic illness causes, can cause fatigue and all sorts of things. And so I think really you have to be able to adjust the way you think about sex and you approach sex, depending on what's happening in your body. Medication's a big one too. There's lots of medications. The most commonly used medications that affect people's sexuality are antidepressants. Now, in our over-busy, stressed world, we all know that the incidence of mental health challenges is greater now than it probably ever has been. And a lot of the commonly used antidepressants have a high incidence of sexual side effects, reduced libido, reduced arousal, difficulty reaching orgasm. And so, sometimes that can set up a bit of a negative cycle too, where, sex, that you're less interested, but then when you are interested, it's more of an effort. You don't get the same pleasure. So I think that they're a really big group. Then, of course, the hormone blockers, which I was talking about before. So estrogen blockers for women, testosterone blockers for men with advanced prostate cancer. So they're the sort of big ones there. So, lots of things. And sometimes those things are unavoidable, but, there are, say, amongst antidepressants, I do sometimes change people from one antidepressant to another, or we'll have a trial offered or something to sort of see whether that can change things for them in terms of their sexual function.
Oh, that's really informative, actually, because like you said, the increase in people suffering from depression now, and they might not realize that's what their medications affecting their libido. So
and post-COVID, a lot of people who didn't feel depressed or anxious.
So I think a lot of people are going to find just that they'll be going to the GPs now and saying, hey,
it's not them, it's the tablet.
Yeah. And I mean, so this is a good spot actually to bring in the conversation about libido. Because so there's certain things that come up in my sexual medicine practice, which, I'd call them timeless perennials, because it doesn't matter what stage of the life cycle you're at, these things are there, they're in the room, they're very significant. The first one I want to talk about is women's relationship with their bodies. And sorry, I might talk about libido first. Sorry, because that's what I was segueing from libido, wasn't I? So we have a way of thinking about or talking about libido that makes it sound like loss of libido is kind of like catching COVID. Oh, I've lost my libido. Oh, I've caught COVID. As if libido is a thing, but really what has become apparent to me when I've talked to so many people and listened to so many people is, if you think about it, like, your libido changes for a whole lot of different reasons. Your libido changes at all different stages of your life, from day to day, from moment to moment. Your interest in and your degree of interest in sex, your likelihood of engaging in sex, it's a very, very fluid thing. So the way our kind of our libido, or our sort of desire and arousal works, is we've got a sexual accelerator and we've got sexual brakes. So it's a continual interplay between things that might be putting its foot on the accelerator versus things that are putting their foot on the brakes, right? And those things can be changing in a very fluid way, like I said, or they can be things that are kind of, really fixed with a real imbalance, where the things on the brakes are just really heavy, which means the accelerator has no chance. You might be doing the accelerator things, but the brakes are going, nah, just not happening. So when we're looking at each individual's kind of experience of what's happening with their libido, we have to look at where are they at in terms of the things that normally might be their accelerator. So let's say, for instance, how they feel about their body. They're feeling really good, healthy, sexy, all of that. Their attractiveness of their partner, novelty. We know that the thing that really kicks people's libidos up, they can think their libido is dead. Give them a new partner, boom, through the roof. Just its novelty can be a huge kind of give a huge kick to your libido. Good quality sex really boosts your libido. So if you're having some nice sexual encounters, then you start to feel more kind of interested. So they're kind of some examples of the accelerator, right? The brakes, well, where do we start? I have this lovely A4 sheet, quite small print under a whole lot of different headings, and I sit there often with women, sometimes with men, and it's called Inhibitors of Desire and Arousal. And we look through and I'll get the highlighter out, because I love my highlighter, and we go through all of the things that are putting the foot on the brakes in them, and then they go, oh, I see what you mean. Okay, so that's kind of why. So it's not just, oh, I'm tired because whatever. It's usually a number of things that all kind of stack up. Something might have triggered them to actually go, hey, yeah, I'm not happy with this, but actually it didn't just start there out of nowhere. So, for instance, examples of things that put your foot on your sexual brakes: gender, culture, religion. So the gender, culture, religion overlay, like a big black cloud, as far as I'm concerned. It's like a big black cloud for women. It's not even great for men, really. Our sexuality is, in our culture, is very polarized. So, for the women I'm seeing who are coming in with issues with pain, with libido or whatever, we always end up going through unpicking this huge list of stuff that's got the foot on their sexual brakes. So it may simply be the standard kind of culture that we've grown up in, which is very gendered, where young girls are never told to celebrate their sexuality. When they're young, they're told to hide it, cover it up, don't be slutty, don't be overtly sexual. That there's something negative about being an evolving girl, owning her sexual energy, her eroticism, her sexual power as a woman. Whoever had that experience growing up as a girl, if there's someone out there,
absolutely,
love to hear it from you. Yeah,
definitely.
Yeah, whereas they're more likely to have come from, even just the basic kind of neutral family, which is where sex wasn't discussed or was kind
Very
of
strict Catholic family, both of us.
Oh,
yeah.
yes, strict Catholic. Sorry for you. I mean, really,
Very guilty. Yes.
I think that's changed for young people now, though. I remember
good.
when my daughter was, I think she was 17 already. She'd already finished high school, and she wanted to go on the contraceptive pill for the first time. And she wanted me to go to the GP with her. And so I went with her, and she looked very, very young. And the doctor said, "Oh, how old are you? About 12?" And I was horrified. And I said, "My goodness, what mother would bring a 12-year-old?" And he said, "Plenty. We're very busy with 12-year-olds
Wow.
being put on the pill." So,
Yeah.
yeah, that
Wow,
really
okay.
I'm glad it's
shocked me.
changed. I'm glad it's
So
changed.
mothers who knew their young girls were
Mm.
enjoying
Their bodies.
sexual intercourse at that age were protecting them at least.
Mm.
But yeah, that really surprised
Yeah,
me.
I was
So
quite surprised.
And
yeah,
it's interesting that you actually used the word enjoying. Now, a lot of those girls aren't actually enjoying sex. They're
no,
Are
being,
they?
the pressure to
Yeah.
keep the
well,
boy. I got to
Oh,
keep the boy.
really? Oh,
Yeah,
it's so
he
sad.
might
so
not like me if I don't. Yeah.
yeah.
Poor little things.
Mm.
Yeah, it's a very complex area. And yes, there's been improvements, no question. I mean, I look at my experience compared with my mum's, and so with each and I look at I've got two daughters. I look at their experience and compared with mine even. And I was a 70s feminist. I was reading The Joy of Sex and looking at all the bodies with their body hair and doing all these things and learning all the names for all the things I did. That was great. I could walk into the local bookshop and buy that. And mum, got married a virgin and didn't even hardly know what sex was. So things are coming a long way. But I think it's really important for us to understand that even for very young people, both males and females, the gender issues are still very present. They do play out differently with each generation, but they have to be acknowledged in all of the kind of understandings that I'm trying to develop, with my patients, because they're still very present. Um, then, of course, there's other things that put their foot on the brakes, biological stuff for men and women, but for women, of course, it's all of the stuff around, gynecological issues. So some women's body, their gynecological genital area is associated with pain. If a girl has really bad period pain from when she first has her period, and she kind of associates that part of her body with pain. And then if she starts being sexual and her experiences haven't been great, and she might experience pain and not enough pleasure, then sometimes, really it can be very problematic that part of her body has always been associated with pain. She may have something like endometriosis, which hasn't been diagnosed, so a gynecological condition that causes pain and often is very late to be diagnosed. She may have difficulties after childbirth because of tearing, surgical repair and stuff that had to happen after childbirth. All sorts of biological events that may happen to a woman's body that can really affect her sexually. Psychological stress is huge with the breaks, and I guess that's a major one for people at the moment. Our world has become very, very busy for people. I look at the difference in couples with children, how their lives are now compared with it. Perhaps when I was doing it 30 years ago, generally speaking, the parents are doing a lot more paid work hours between them. They're still trying to fit in everything to be great parents and keep the house nice and pay the mortgage. And they're actually all too busy.
Yeah.
The
Tired.
normal has become too busy.
Yeah.
The normal has got to the point where it's very difficult for people to thrive emotionally, and if you're not thriving emotionally, it's pretty hard to thrive sexually.
Yeah.
So that's a huge one at the moment. Relationship issues put the foot on the brakes. Too busy, too tired, too distracted. I have patients who I say, so what do you do in the evenings when you're together? Oh, well, we'll be on our phones, and they'll be on their phones with a dog sitting between them. Like they're not even having a cuddle on the couch at night. They're either watching Netflix or they're on their phones, or they're, so distracted by, those incredibly entrancing little devices. And then, of course, things like too many emotionally numbing behaviors, alcohol, um, eating too much, binge watching Netflix, all of those things are kind of just trying to kind of just numb what you're feeling. Well, that doesn't put you in a really kind of in a kind of state where sex is likely to actually come on your radar screen. So that the breaks, unfortunately, for a lot of people, a lot of aspects of modern life rolled in with individual experiences, separate from the whole world, actually are really putting their foot on the brakes.
Yeah.
So that's a big one with libido desire. So so when we're trying to address libido issues, we have to look at what's affecting their brakes and how can we get the accelerator working a little bit better. So it's a complex, often quite complex, and but nevertheless, there's always ways to improve things, and it's rarely a quick fix. There's very rarely one variable that you can treat and then things get better. There's usually little things that we need to tweak, change the way they think, shift their expectations, all those sorts of things, and then we can improve things.
Yeah,
So
I mean, sometimes, particularly that last one with all the distractions, I think when you've been married a long time in particular, you start to fall into, really lazy
You've got to
patterns,
spice it
don't
up.
you?
You really do.
Yeah, you need to be committed
all
to
the
saying,
time.
hey, let's have a date night
Mm.
or a date day, one day a week, and really just focus on each other.
Well, I had to
Yeah.
work I worked for a cosmetic surgeon for years and years, and he made me be in charge of the breast implant stand. And I'd never been at Sexpo, and that my eyes are out on stalks. Being my upbringing was quite interesting, but I learned a lot being there. I spent many days there for many years running the breast implant stand because he was number one. But oh my goodness, it was a whole different world.
Yes, I bet. I bet. Yeah, so that's the kind of little think about libido. Now, I did talk a little bit before about the sort of putting intercourse at the pinnacle of our kind of sexual behaviour, and I think that that's a general issue. So when I talk to my patients, whatever their age, but I think this is very relevant for my older patients because of their age and their, the lack of kind of questioning of social norms, perhaps particularly by men. Is to try and help them reframe what sex is. So as I said before, and I'm going to say it again, what is sex? To me, this is my definition. I haven't got this out of any sexology handbook. This is Dr. Jane's one. It's anything that we do either on our own, so it could be during self-pleasuring, masturbation, because after all, our first sexual relationship is with ourselves. It's anything that we do either on our own or with another person that actually unlocks and taps into that kind of sexual energy, that erotic part of ourselves, and results in sexual pleasure. That's what sex is. So, to remind people that if part of your anatomy is letting you down and it's disheartening for you, that does not mean the end of sexual pleasure and sexual intimacy for you. The other timeless perennial, I want to go back to the thing about women's bodies that I've mentioned very briefly before. So women's lack of love for their bodies. So, we live in a capitalist culture now. Really interesting that you have worked for a cosmetic surgeon. This is a part of this industry, okay? So the big capitalist juggernaut that we're all part of actually thrives on people. Well, I would have said women in the past, but I would now say everybody, because men are as much victims of this as women. Not being happy with themselves, not being happy with their bodies, not being happy with their appearance, not being happy with how they present themselves to the world. So there's huge amount of pressure to somehow improve yourself, somehow conform to some sort of ideals. And so why does this affect sex? Okay, so let's say when you're being sexually intimate with someone, if you're worried about how your boobs look, if you're worried about sucking your tummy in, if you're worrying about, whether your pecs are big enough or whatever, you're in your head. You're thinking about something outside of your body. You are not connected to what's happening in your body. In order to really experience sexual arousal, you need to be in there feeling what's happening in your body. So you need to be, sensing, smelling, looking, and feeling, appreciating the touch, all of those sorts of things, so that then is feeding into your kind of erogenous kind of, parts of your brain and starting to build desire and arousal. The minute you suddenly go, oh shit, you're thinking about suck my tummy in, or will you think my boobs are saggy or whatever, you're out of your body, your arousal will start to drop down again. So, so you really, need to be able to be very present and in your body to actually experience arousal. And there's many, women I speak to who really have sort of shut down a connection with their body. Now, we talked before about women who experience pain during intercourse. When the experience is causing pain, then it's quite helpful for your brain to protect you by kind of shutting down feeling from that area. So if someone's had pain for a long time, it can be quite hard to get them reconnected in a really positive way with appreciating sensation, pleasant sensation. So the concepts of mindfulness, of being present, are really a huge part of helping us enhance our enjoyment of sex, learning how to be really, really present, using all our senses, letting our senses feed that stuff into our brains, and trying to just when the inevitable outside thoughts keep coming in, because they will, that's normal. When they do, it's just like, okay, let it go. I'm doing that thing again. I don't need to do that. And just don't judge it. Just let it go. So I think that's a really, really big one, whatever your age, whoever you are.
Yeah.
So
Yeah,
let's
absolutely.
talking
That,
about, go on, sorry.
yeah, just that whole, women being so conscious about their bodies. I think I read it when I was doing bits of research, and men, unless they're quite shallow, aren't worried about what a woman's body looks like. They want you just to enjoy, and
Them.
yeah, and it actually puts a damper for them when women are so obsessed with turning off the light and
Yeah.
hiding their
Exactly.
stomach. Yeah,
You're,
men
you're
don't
so
want you to do
right.
that.
Yeah, the most sexy thing about a woman is a woman who's really enjoying being with you, and you try and say that to them. And you also say to them, hey, just look at him. He's not too worried about having a bit of a pot belly or saggy balls or whatever. What he wants is a woman who just relishes being with him, who's really into just being with him and loving her own body and loving her sexuality. And that's the most arousing thing for a man. And
Yes,
you're
that's
quite
very
right.
sexy, isn't it?
It
Confidence is
really,
sexy.
Well, good personality is very sexy.
yeah,
And
exactly. But
have the comedians,
Yeah.
humour. Yeah.
yeah, exactly. But just that thing of having that confidence in your body and kind of being comfortable with your sexuality is the most sexy thing for a man. Yeah.
Mm,
Yeah.
good
So
point.
there's always lots and lots to talk about. I've
Social
done
media doesn't help us, does it?
social media is huge. And I think that's huge for young people. So where we might say young people are more sexually liberated and all of that, then they're dealing with the incredible pressure from social media.
Enormous.
Mm.
We
Yeah.
have to mention porn with young people. I think I think the easy availability of porn, the poor quality of sex ed, still sex ed in Australia is pretty abysmal, and young people basically now learning through porn is probably worse than not learning at all.
Oh, absolutely. I know that from my counseling days. Like, those young minds, if they're seeing too much porn and they start to think that's the reality of the sexual experience, and then they're not satisfied because they can't reach that in
Yeah,
real life.
yeah.
And, it's an overstimulation. And I know.
I just wanted to take a few minutes before we finish to talk about the issue of repartnering in any time in life, really. When you go from perhaps having been in a very long-term relationship, often perhaps a relationship where there were children involved, and it's a complex time in life, you become single. Long-term couples often become quite sort of routine and sort of fixed in their what I call their sexual script. It's kind of like sex just tends to happen the same way always, kind of has its little thing and you do it and it's nice and but it gets a bit sort of mundane. Or you perhaps, there's stuff going on in your head, but you're not brave enough to talk about what you'd really like. And, because you've been with that same partner, it just sort of, you don't really maximize what you could be having in your relationship. Okay, you become single. You've got a complete opportunity to reinvent yourself, to really try and connect with what might be there for you sexually, which didn't flourish in a previous relationship, or because you were much younger, or whatever, for whatever reason. But it's always an opportunity to really connect with your sexual self and to say to yourself, is there stuff I want to let go of? Do I want to let go of that silly body consciousness, that worrying about how I look when I'm with someone? Do I want to, start to actually explain about how stuff feels? So, because a lot of women avoid certain sexual practices because they haven't been able to sufficiently communicate with their partner about what feels good. So let's take oral sex. Why not talk about oral sex? So women often say to me, oh no, I don't like receiving oral sex. It just doesn't feel right. Well, it's a really nuanced thing. And unless they can explain to their partner, what they enjoy, what feels good, then quite often they'll reject something because they weren't able to communicate with their partner, or that partner was not sufficiently interested, skilled, whatever, to actually achieve, make that a pleasurable thing for them. So with different partners, and as a single person, again, where you might be having the opportunity to just try out sex with a few different people, try letting go of old stuff like, oh, I don't like oral sex, or whatever. Just try things again and be open-minded and see if you can start to experience aspects of your sexuality which, as I said, didn't flourish for you for whatever reason in a previous relationship. The other thing I want to say is that our biggest sexual organ is our brain, and communication. Our mouth is our most important sexual organ, really, because in terms of communicating with our partners, it's actually being able to talk and say what we enjoy, what we don't enjoy. Do this, do that, move here, move there. Whatever. You have to be able to communicate with your partner. They can't just magically intuit what you want, what you need. Our bodies are different, our bodies vary. What might have worked for one partner might not work for another partner. And I think one of the beautiful things about being a more mature person, an older person, is hopefully having the confidence to be able to actually speak what it is that you're feeling, speak what you desire, all of those sorts of things. Make it fun. I think sex can be really fun. It can be a bit silly sometimes when you think about it, but it should be fun, it should be pleasurable. And as in midlife, with repartnering, or even if it's just dating and enjoying being single and maybe having a few different partners, or maybe having a friend with benefits, or whatever it is. I think often with relationships later in life, we still think in a fairly kind of binary way, in that we think about, we'll either be in a relationship and we'll eventually move in together and we'll live together, or we'll be single. Well, there's lots of different ways to be in relationships when we're older, and I think this is not my expert area. I think it's more of an expert area for you. But just I quite often talk to people about, well, hey, this relationship might be a great relationship for you, but not as a forever or a live-in relationship. This might be a great living apart together relationship. And they go, oh, okay, is that a thing? Yeah, sure, of course it's a thing. Where you have a partner, maybe it might be exclusive, maybe it's not, but you don't necessarily ever consider cohabiting, but it can still be a very meaningful relationship, emotionally and sexually. So I spend a lot of time talking about that kind of stuff with my midlife kind of patients.
Yeah, that's fabulous. I mean, that's the kind of relationship I want the second time
Yeah,
around. I don't want the
yeah.
24/7, but I want a
Mhm.
committed relationship where we
Yeah,
don't live together.
yeah,
Yeah,
yeah. And
that sounds fabulous. And
yeah,
and
and
reinventing my sex life again. That's
yeah.
yeah, I like the sound of that.
Yeah, yeah. And I mean, I'm currently in that type of relationship and have been for about 4 years now. I didn't set out thinking that's what I wanted. I had no particular preconceptions, but I probably used to think more about moving into a full-time relationship again. But as it's panned out, I've discovered that that's not really particularly for me at the moment, even though I'm lucky to have a lovely partner. Fortunately, he's also very happy with the arrangement. So, I think, particularly for women, I think, who are often quite submerged by their relationships, and relationships often involve a huge amount of emotional giving out to others and very little space left for a woman to really connect with her own needs. That having gone through a period of being single, where hopefully, if you have managed to connect in a really healthy and positive way with your authentic self and what your needs are and what you like, then you're in a position to work out what sort of relationship is going to work for you at that stage in your life.
Fabulous. That's
That's
fabulous.
great wisdom.
Yeah, yeah. Almost all men who I see with sexual difficulties, I always ask about porn, because it's so prevalent these days, and even sort of doesn't matter what the age is, but so a lot of let's talk about older guys, because that's what we're supposed to be talking about, older
Mhm.
guys, older
Yes.
people. So they may have been single for a period of time or whatever, and they're starting to have some erectile difficulties. Many men, as part of their healthy sexuality, do continue to masturbate, whether they're in a relationship or not. And if they're not in a relationship, they're perhaps, that might be the only sexual kind of pleasure they're having. But if they're regularly masturbating to porn, porn is this hypersexualized like stimulation. It's nothing like real life. I mean, it's like a Superman action movie, as opposed to just, watching a couple of people walk along the beach. There's no comparison really with the intensity of the stimulation and the speed and the activity and all the stuff that's going on. It's a really hypersexualized kind of experience. So men who might be starting to get erectile dysfunction sometimes can still masturbate kind of fast and furious to porn because of this hyperstimulation. But then when they're in a normal situation where there isn't that hyperstimulation, that's when they might start to, experience their erections taking longer, and then that makes them anxious, or their erection starts to wane, and that makes them anxious. And so sometimes we have to do a porn detox and actually get them off porn for a while and just back again into their bodies, because they're relying entirely on this incredible visual stimulation into their erotic brain. It's like, huge amount of erotic input, whereas by taking that visual input away and just getting them to connect again with what are they feeling, feeling that the touch of their own hand on their penis, feeling that gentle build of sort of the erection slowly coming, and trying to get them to connect back with a normal kind of sexual arousal without that stimulation, so that then when they're translating it into a coupled situation, that they can't suddenly freaking out because they can't get the erection the way they do normally. And so anxiety for men, and obviously partnering in later life is a very common occurrence these days. It's a normal occurrence. And so sometimes the anxiety with them really kicks in because they're really worried about performance with a new partner. They're worried about not satisfying her, that she'll feel let down by him, that she won't want to pursue a relationship if he's got sexual difficulties. And so that sort of cycle of fear of performance failure and then anxiety, which then actually makes performance decline more. That's a really significant thing for men. But porn detox, not always, but it's always something I ask about, because that often is an issue.
It's interesting.
Yeah, big issue. Big issue.
Yeah.
Well, Dr. Jane, that was fabulous. I think we're going to have to turn this into 2 episodes.
Yeah, I think
it was so interesting.
There'll be so many listeners that wish they lived in Mornington, in Victoria, to come and see Dr. Jane Offor.
Well, I do video consultations?
Oh, you do?
Yeah, I do.
Perfect.
I do now. Yeah,
Great.
yeah. Yes,
that's fabulous.
I think it's another one of the things that, the good that comes from COVID, if there was any, was that now there are Medicare rebates available for video consults when you work in a specialty area such as sexual medicine, sexual health, because many people live in parts of Australia where there is no opportunity to engage face to face with somebody with specialist skills in sexual health, whether it's being, anything to do with sexual health. So now you can get a Medicare rebate for a consultation with a specialist sexual health practitioner doctor without having ever seen them face to face. Whereas for general GP stuff, you generally it has to generally be a clinic that you normally go to. You can have a phone consult or something with them. But yeah, so video consults still attract the same Medicare rebates as you would face to face. So
wonderful, isn't it?
Yeah.
I think that sort of thing is really important for people who live in rural and remote areas. And I think that was a good.
Well, you might end up. We're going to have an international audience of listeners as well, so you might end up doing Zoom consultations with people from overseas. They won't be able to get our Medicare rebates, of course, but that's all right. So, Dr. Jane, so informative, so interesting.
Fabulous.
Have you got, we like to take the session out with some words of wisdom. Have you got, words of wisdom to make people feel better about sexual dysfunction?
Yeah, look, I think that our sexual energy, our erotic self, it's an essential, it's part of our intrinsic humanity, and don't let aging, don't miss out on it just because you're getting older. I mean, as we get older, we have more opportunity for pleasure. We have more time for pleasure. Sex is essentially about pleasure, connection, and I think we need to make room for more pleasure in our lives, and particularly, let's say, as women, where we're not really good at prioritizing pleasure. Sexual pleasure is a lovely thing, and there's many ways to remain sexual as you get older. And if you're struggling with any aspects of it, go and get help.